Remember, we talked about this earlier, the primary site of testosterone production in a woman is the ovaries, not the adrenal glands, but the ovaries. And women who have PCOS tend to have less aromatase activity. Aromatase is the enzyme that converts testosterone to estrogen. So remember that the ovary makes primarily testosterone. Aromatase converts testosterone to estrogen, to estradiol and estrone. The theca cells in the ovary also have increased androgen production. So not only do they have less of the aromatase, they also produce more of the testosterone. And that increase in testosterone production by the theca cells can cause hirsutism, hair where it doesn't normally grow, like on the face and other parts of the body, deeper voice, and infertility. Remember, if there's no ovulation, there's no progesterone production. If there's no progesterone production, blood sugar levels tend to go up and insulin resistance becomes more common. So that's another key piece to keep in mind with PCOS. No ovulation, no progesterone production. And this is just a reminder, testosterone by aromatase converts to estradiol, or androstenedione, the aromatase converts to estrone. So there's both an overproduction of testosterone and an underproduction of the aromatase. So this is what happens in a normal ovary. There are primordial follicles. And by the way, to me, this is just an incredible factoid. Women have all of the follicles in the ovary that we will ever produce by the time we're about 4 months old as a fetus. So the health of our children is already determined while we're still in the womb. So what happens to the mother during our fetal development, in fact, affects her grandchildren. So we have all the follicles we will ever make, a lot of them, like 250,000 of them. Thankfully, we never have that many menstrual cycles. So there are primordial follicles, and then the follicles are in different stages of maturation. Becomes a primary follicle, then secondary, then a mature follicle. The mature follicle at the time of ovulation, that follicle, that the balloon bursts, releases the ovum, and then it becomes the corpus luteum. This is all happening in one place on the ovary. They just do it this way to show you the changes, but it's all happening in one place on the ovary. And then after the corpus luteum is done for a particular cycle, it becomes the corpus albicans. It looks white after it's done producing the progesterone. What happens though with polycystic ovarian syndrome? Here are the primordial follicles. It becomes primary, secondary, whoops. And then it doesn't continue the developing. That's it. They just stay at this stage. They never completely mature and then go through ovulation and the development of the corpus luteum. So that's why the ovary looks lumpy and bumpy. It has all these incompletely developed cysts that never completely finished maturing and then went through ovulation. Okay, so let's look at some of the supplements and botanicals that can be helpful. Spearmint, mentha spicata. This was a relatively small trial, 42. They drank 1 cup of spearmint tea twice a day. Easy dosing. And the control drank an herbal tea. They didn't specify what the herbal tea was, but it did not have any spearmint in it. And they found, they checked the androgen levels, because remember, there tend to be higher testosterone and androstenedione levels, and gonadotropins at 0, 14, and 30 days. They found that there was decreased free and total testosterone after 30 days, and there was increased FSH and LH. And it's FSH, follicle stimulating hormone, that stimulates this final bit of development, and then LH, luteinizing hormone, that encourages the conversion of what was the follicle into the corpus luteum. So FSH is the most important in this part, and LH is most important in this part, in the development of the corpus luteum and the development of increase in progesterone production. The women reported that they had improved hirsutism, the hair growth, but it wasn't corroborated with objective findings. They actually did photographs before and after. The researchers also noticed this was only a 1-month intervention, and they said, that's really too short a time to see significant changes with follicular hair growth. Hair is a relatively slow moving. It can take up to 6 months to see really significant changes in hair follicle growth. Cinnamon, Cinnamomum verum for polycystic ovarian syndrome. This is a standardized water extract of cinnamon, Cinnulin PF. It's proprietary, standard for the type A polymers, and this is type A polymers are used in the research on metabolic syndrome. In this particular study, there were 45 women. It was a placebo-controlled trial. 125 milligram capsules. They did 4 caps of the 125 milligram caps 3 times a day for 6 months. So the total is 1.5 grams daily. That was their dose. So the women who were taking Sinulin PF, they had more frequent cycles compared to the controls. The cyclicity improved from baseline in the study group, but not in the control group. And the luteal phase increase in progesterone was better in the study group, but not in the control group. There was no change in insulin resistance or the serum androgens for either group. We saw changes here with the Spearmint and the androgens, but not here in the cinnamon group. It's primarily focused on the blood sugar regulation. And this was confirmed in recent meta-analysis that the cinnamon is really helpful for stabilizing blood sugar levels for patients with PCOS. Green tea, Camellia sinensis. Isn't that gorgeous? That's a green tea plantation. I want to move there. So in this trial, there were 60 women who were overweight and obese and had polycystic ovarian syndrome. There was no difference in the fasting insulin levels at the onset of the study between the control and the study group. The experimental group was receiving 500 milligrams of green tea capsules twice a day for 2 weeks. It's not a very long study period. And the control group had placebo. The experimental group had increased weight loss, decreased fasting insulin, and decreased free testosterone levels. So this is a double bonus. It was both affecting the insulin and the testosterone levels. And this is from a systematic review of green tea extract for polycystic ovarian syndrome. They found across a variety of studies that there were decreased androgen levels with green tea supplementation, increased estrogen activity, less luteinizing hormone, more follicle stimulating hormone. This is good because we want the ovulation. There was less gluconeogenesis, increased insulin sensitivity, less insulin resistance. So this is all related to improving the metabolic syndrome symptoms that are associated with PCOS. And there was also less inflammation. There's something now called diabesity, which is there's a combination of inflammation and diabetes. And so the combination of the increased adipose tissue and inflammation is a really bad combination. And they found less of that inflammatory condition. That's a summary, lovely summary of the dosing. So this is one way of dosing the green tea, just to give you a very specific recommendation. Pure Encapsulations makes a green tea extract that's decaffeinated. To me, that's really important, especially if they're going to be dosing twice a day. Some women are very sensitive, and it does have very small amounts of caffeine per capsule, but very, very much lower than like a cup of caffeinated tea or coffee. It's 100-to-1 herbal extract. It contains a minimum of 90% catechins with epigallocatechin gallate, EGCG, which is the most researched of the different specific catechins. And it makes up at least 70% of the content of this green tea extract. It provides antioxidant support for all the cells in the body. 1 capsule equals approximately 2 cups of tea. So when I was working with cancer patients and we were recommending green tea, then they said, well, what if I'm drinking green tea? Well, if they're drinking 2 cups of green tea, they could drop 1 of their capsules. So you can mix and match with the green tea, drinking it, and the green tea capsule. So 2 to 4 caps per day in divided doses. So either 1 cap twice a day or 2 caps twice a day, depending on the patient.